So, what are peptides and why are they important? In your body, you've got chains of amino acids, and these chains of amino acids are what create the communication patterns between your cells. So, your DNA are these letters, and the letters are encoding all these different genes, and it's the peptides that trigger the communication from one cell to the next. A peptide can be like an enzyme or similar to a hormone. Peptides create cellular structures in our body, and there's over 7,000 peptides in your body. And so by optimizing the way that your peptides work, you can optimize your health, because there's peptides for growth hormone, there's peptides for fat burning, there's peptides to help you feel full. There's actually peptides for sexual function and sexual wellness. There's peptides for your skin, peptides for your heart, and peptides for your blood vessels. And so by having your peptides optimal in your body, whether you're using it from an oral source or injectable, or you're doing things like saunas to help increase your own peptide population, once those things are optimal, then your health will be optimal. Where do peptides come from? Peptides that we use come only from the 503A and 503B pharmacies, and these are pharmacies that are overseen by the FDA, so everything is sterile. The peptide structures that's in the bottle is what you're actually getting. A lot of peptides, at least 80% of them, are from sources that are not from compounding pharmacies. And some of these sources, when we've tested them, you'll see that it's not the full amino acid structure. Some of these peptides may be contaminated because they're not mixed properly or dosed properly. And so make sure when you get your peptides, they are prescriptive based from compounded pharmacies. Why do I need to do your labs over my doctor's blood labs? And one of the things that I realized early on in my career is that the traditional allopathic blood markers, maybe the test that you get at your annual physical, most of these tests have 10 to 24 biomarkers. So like maybe a metabolic panel and then a complete blood count. And what we want to look at is all your hormones, your thyroid markers. We want to look for specific inflammatory pathways. We want to look at cardiovascular function. So we want to go deeper than what most blood labs look at. And so in our tests, we run 94 different markers. And what we found is that by identifying where your interferences are and your deficiencies from running the right labs, we can help optimize your nutrition, optimize your performance, and get your mental health as well as it could possibly be from just that simple test. Does injecting peptides hurt? Well, it's a little insulin syringe, and if you inject it properly, you want to push the peptides in slowly and angle the needle at about a 60-degree angle, and most of the time you won't feel anything. We've actually had hundreds of clients concerned about giving themselves an injection, and what we found is that many people actually prefer the injection over pills. But some peptides are better taken orally, some are nasal spray, some are going to be topical, and a lot of these are going to be what are called subcutaneous injections, so they just go right below the surface of the skin. And we make it as simple and pain-free as possible, but in general, if you do it properly, it shouldn't hurt. Am I going to have to give up everything I love? And do I have to fast and go long times without food? Yes, as a matter of fact, everything you love is going away when you work with. Okay, actually it doesn't, but what we found is that some of the behaviors that we pick up on can be destructive to our health. And so, I look at things like fast food or sodas, and those aren't a big part of longevity medicine is what we've kind of learned. I know Warren Buffett, he drinks a Coke every day, so maybe there's some exceptions, but in general, what we use are peptides to help get rid of some of those cravings, because a lot of you have behaviors, a lot of us, any humans are going to have some biology that we need to overcome. And so we use peptides like GLP-1 agonists, like tirzepatide or semaglutide or retatrutide. And what we found is that your cravings go away. Even alcohol. I have one of my clients who owns some of the most extensive wine collections in the entire state of Utah. And he's like, Reagan, I don't even like wine anymore. And so it's a good thing because his health has improved exponentially because he's been able to get rid of those habits. And so we don't want to take away the things that you love. Actually, we want to create more activity, more enjoyment, and more fulfillment out of things that are actually healthy for you. And we use peptides to bypass that biological urge to do things that can be destructive. Do you work with the doctor I'm already working with? Absolutely. We love creating teamwork because the more people you can have on your team, the better. And health is something that we take very seriously. And so if we can have an open dialogue with your cardiologist, your nephrologist, your endocrinologist, your gastroenterologist, your oncologist, whoever it may be, and especially your primary care doctor, then we can create a better team around you because their job is to make sure that they're focused on the disease if you are managing any kind of medical condition. Our job is to make sure that we're optimizing your health. And so by working as a team, you'll just get better results and you'll feel more confident about your future. Do you do hormones? So at EastWest Health, we do have hormone experts. So Tasha Sanner, who's a functional medicine nurse practitioner, David Sorensen, who's a functional medicine physician assistant. Both of them are experts at hormones. And when I say experts, that means they've trained with the best of the best. They're up to date on the latest research. And based on your labs, they'll help you find out if you're a man, what the best testosterone therapy may be best for you, or maybe they'll want you to try something natural first. And if you're a woman, it's the same thing. They're going to look at your progesterone, your DHEA, your estrogen, and your testosterone and make sure that your hormones are optimized. Because one of the things that we've said for years is if you don't think hormones are necessary or not important, try going without them. You'll regret it pretty quickly. So we want to make sure your hormones are optimized. We've got a great team to help you do that. For example, we have a lot of men who come to us who they go to a testosterone clinic and maybe they run like 3 markers and they say, oh, your testosterone's low. And so you get put on these testosterone injections. And then what they'll do is they'll give you an aromatase inhibitor or an estrogen blocker like arnestazide. And some of the problems with these medications is they can drive down estrogen too much. You lose your libido, your body doesn't feel good, your brain doesn't feel quite as well as it could. Or if you're on too high of levels of testosterone, your body can start developing a resistance to it. And so what we want to make sure that we're doing is looking at the gut profile, looking at the way your liver functions. We want to make sure you're doing detoxification so that if you do need hormones, you're actually doing it in the right way, because so many clinics, they're not up to speed on the data and they just want to put people on hormones. So we have to clean up those messes, and hopefully we can help you prevent that by watching this video. Do I have to come into the office? No, as a matter of fact, you get peptides shipped right to your house. And even with our regenerative medicine at-home kit, you can do your plasma exchange, your exosomes, even you can do your stem cell immune rejuvenation with subcutaneous injections, the same way that you do your peptides. And so with just a couple of minutes throughout your day, few days out of the year, you can literally start turning back the clock without ever coming into the office. There are instances where you do want to come to the office, and here's what they are. If you've got issues with your spine and you need treatments directly into your back or your neck, or if you've got issues with your knee, maybe you've got bone on bone or arthritis, those are times where you do need to come into the office. If you're looking to get your brain treatment, maybe you've got some ADHD or maybe you've had some traumatic brain injuries, it's very important that you come into the office, because those procedures do need to be performed by our regenerative medicine specialist, Dr. Steinley. And these procedures are easy to perform. Usually you come in for a couple of hours, you can fly in and fly out the same day. There's not much recovery time, but those are the cases where we absolutely want you into the office. Can my spouse do this with me? Yes, as a matter of fact, we encourage that couples work together. However, we do have a no nagging policy. So that means if your husband's not doing everything just perfect, let us know. We'll do the nagging for you. Or if your wife isn't quite staying on the wagon the way you think that she could be. Well, just let us know and we'll handle that, because we believe in very strong, healthy relationships. And actually what we've seen is when people focus on their health together, that creates some of the most dramatic transformations in their relationship, because now the kids get healthier, your friends start seeing the changes that you've made, and it makes things easier because you guys are both cooking the same, you're eating the same, you're doing the same exercise, you've got the same vision. So yes, we prefer for you to have your spouse along with you. And one of the great things you can do if you're in the program and your spouse isn't, is you can bring your spouse to one of our wellness retreats. And these longevity retreats, they're VIP days for you, where you come in and we take you through worksheets, we do vitamin IVs, we have a peptide party, a stem cell party, and it can be one of the most immune enriching days ever based on the treatments that you receive, and you'll have access to an amazing community. How much does it cost? That depends. The very first thing we want to do is get your blood labs going, because once we see what we're up against, then we can build a customized program tailored just for you. And so if you look at this as an investment instead of a cost, because these are things that your insurance company is not going to cover. And so one of the things that we'll do is we'll be very transparent before we do any kind of work with you, and we'll give you options as far as what the investment will be, and we'll give you chances of having programs that fit within your budget. What kind of support do I receive? You get total clarity from the blood work and irrefutable proof of what's out of balance in your body. You'll also get a detailed list of supplements and monthly peptides. And one of the things that our clients love is that monthly package from us. And that package, or from the pharmacy typically, but what that package is this is your next phase of care, because we believe in cycling treatments. So a lot of clinics will run your labs and then they'll keep you on the same thing for almost a year. And what we want to do is we want to cycle you on and cycle you off the right peptides. So depending on what you need, we're going to give you access to a team of experts. So you're going to have a fitness advisor, you're going to have a nutritional advisor, and they're going to help create the knowledge that you need so that you can have lasting behavioral changes. And the great thing about that is you have a roadmap, so you know exactly what you're doing every single step of the program. So every program, there's different phases, there's different strategies, and there's different treatments. What will my blood labs look like at the end of the program? Generally, we see a phenomenal improvement in your labs. For example, we usually will see someone will have an average of about 32 to 40 markers out of range. And then when we rerun your labs, yes, there may be some other things that are adapting. So don't be concerned if your labs aren't perfect. We don't see that. We see your body's always in this adaptive mode, but we see those 30 to 40 markers get cut back to like 15 to 20. What is the difference between my doctor who said he can get me peptides and you guys? Well, if your doctor can get you peptides, that's phenomenal, because it's probably coming from a compounding pharmacy. If it's not coming from a compounding pharmacy, we don't know the quality of it. But the difference that we do is we stack peptides, because what I've learned is peptides are like instruments, musical instruments. And so, imagine listening to a guitar player and you're like, man, that solo guitarist is amazing. But then you bring in the drums, and then you bring in the violin, and then you bring in the bass, and suddenly you've got this orchestra. And so what we've learned how to do at EastWest is to stack the right peptides in your protocol so that your whole orchestra can play uniquely. And every single month we're tuning up the genes. So we do have a more unique process of stacking peptides that you may benefit from. If I get on peptides, do I have to stay on them forever? Well, I've got to warn you, peptides are one of my favorite treatments. I mean, these therapies have changed my life, everything from my recovery to my sleep to the way my brain functions. And so I've been on them for over a decade. And so once you start using them, there's a good chance that you're going to want to continue the momentum. But there's not a single peptide that we want you on for the rest of your life. And I think that's a big fundamental difference, where you see people concerned, they're on these weight loss peptides and they're on them for years on end without any breaks. So we like you to be on a peptide for 1 to 3 months at the most, and then cycle off of it so that you allow your body a chance to produce the peptides on its own. So generally, we don't have you on the same peptide forever. So we want you cycling on and cycling off of those. Is there a way to increase the speed and effectiveness of these treatments? Well, the fastest way that you can start getting the results you want is to come to our monthly VIP longevity retreats. And this is where you can do more for your health in a day than most people do in a year or even their lifetime. At the retreat, you're going to meet amazing like-minded people. You're also going to get the peptide party, so you'll get access to all the leading peptides, and you'll get our stem cell party, so you'll have a chance to do novel treatments, and you'll be able to do it at a discounted rate. The other thing that we'll do is we'll take you into our biohacking room where you can get the latest technology to help improve your circulation, your brain function, nutrient absorption. We'll show you how to reduce inflammation and increase mobility. And you'll even have a chance to work with our fitness team and see what your biological age looks like. The other test that you'll have is we'll run your blood work before the longevity retreat. And then when you're there, we're going to do 2 tests for you. One would be a carotid artery scan, and that's where we can see any types of plaque buildup. We'll look at how old your carotid arteries are. So it's called the CIMT, so the carotid artery thickness. And then we're going to do a VO2 max test, so we can see your metabolic capacity, which are some of the most important markers. And then the second test we'll do is what's called a STIQ. And the STIQ will give us a percentage of fat to muscle ratio. So it's one of the most accurate predictors of body composition. Why do you stack peptides with blood labs? What are the benefits? Well, I think if somebody is recommending peptides without blood work, then they're flying blind a little bit because they don't really understand what's causing some of the symptoms in your body. And I think peptides, because they're so powerful, it requires an enormous amount of precision to be able to look at labs and then to bring in the right peptides at the right time based on what your body needs. And so many of our patients that we work with, they're very sensitive. And so we want to make sure that we're stacking the right peptides throughout the course of a 6-month or a 12-month program. And especially in our Ageless medicine program, we're using very specific peptides every single month to knock out each one of the 12 hallmarks of aging. And so what we found is that by stacking the right peptides based on the blood labs, what used to take us 3, maybe 6 years to get your body where it needs to be, now we can accomplish it in 6 to 12 months. How long will it take before I see results? Most of our patients come in and we see results within the first 30 days of working with them. Now, these results can be ranging from anywhere from less pain if you're getting regenerative medicine treatments to my brain feels like it's turned back on. Most people, when they do the brain rejuvenation treatment, their brain feels better within the first 24 hours. That's not uncommon to see. People get up after that treatment, they can see clearer, they can smell better, they look brighter. The peptides, most people will start losing weight within the first 30 to 90 days. It's not uncommon to see energy improvements in that first 60 days. And it's not uncommon to start sleeping better in that first 60 days because in your very first program, our Accelerate Wellness program, we take you through 3 phases. The reset phase, where we reset your stress response in your body, we reset your blood sugar. And that's 60 days where now your body can actually start to heal. And then we take you into the next phase, which is the recharge phase. Now that's where you'll notice better mitochondrial function. You'll notice that you are looking better. You'll look in the mirror and say, wow, I'm starting to notice a change. And then the final phase is what we call the restore phase. And that's where you notice that you start building muscle mass, your endurance improves, your metabolism improves, and now you've got new habits that you can take with you through the next decade of your life or longer.